Welcome back to The Exam Room, a podcast where we dive deep into the world of value-based care, patient-centered healthcare, and improving health outcomes with your host, Dr. Rhiannon Winsor. Dr. Winsor is a certified surgical technologist, healthcare educator, and the manager of training at VB Care Network. With almost 30 years of experience in healthcare and instructional design, she's spent her career helping clinicians and care teams optimize patient outcomes. You'll also hear from Bent Brayman, our media and graphics design producer here at the Exam Room podcast. Bent brings over a decade of experience producing multimedia content in the healthcare space, including work with major organizations like the Core Institute and the University of Phoenix. From video production to motion graphics and audio storytelling, he's the creative mind behind how this podcast looks, sounds, and feels. And when he joins the conversation, he brings a unique perspective grounded in both design and real-world healthcare experience. If you could fast forward 5 years, what would the ideal health center look like? In this episode, Dr. Winsor sits down with Dr. Robert Babyar one last time to explore his vision for Adelante Health Center and the future of community health. They talk about integrated services, staff retention, value-based care, and how partnerships can drive both quality and sustainability. It's a forward-looking conversation with insights for every health center leader. We thoroughly enjoyed this conversation, and we're sure you will too. Let's get into it.
So if we were to jump in a time machine and fast forward 5 years from now to the ideal health center, what do you see?
The ideal health center, and some of these pieces are now, some of them are in progress, in development. Some of them haven't been thought of yet, I'm sure. But when I look at the health centers and what we want to do, I'll talk about the broader and then I'll narrow it to Adelante specifically. From a broader standpoint, having the integrated services to provide that well-rounded comprehensive care is important. Having recognition for the value of primary care and the things we do in the industry, i.e. the payers, as well as our communities, is going to be important. How do we make sure that we're giving all of the services and all of the stuff we can and get that recognized in a value-based proposition so that we can be reimbursed for that and show that this has value? Sometimes you have to show it before the insurance companies come around. There was a cardiology group that knew having a nurse in their office to do their post-catheterization follow-ups improved their outcomes. They kept going to the health plans and saying, we want more reimbursement for this procedure because we're doing this extra work and it's helping you have better results. And for about 3 years, they said no. And then in the fourth year, they said, well, here's all the data we've been collecting over the last 3 years, and here's our readmission rate, and here's our failure of cath, and here's the issues that are always the concern that drive up the cost of care. And they say, we're this much better than everybody else. We need at least some of this back. And the insurance companies looked at it and said, you're right. You guys are providing good care. Kind of where it started down that value-based care proposition. We have to be able to show that. For Adelante specifically, my long-term vision for Adelante is that we are the bellwether for people to say, that's what we need to be like. That's how we need to do it. So that we have staff that don't leave because they're unhappy. They leave because what I like to say is life happens. I've had providers that have left because they have sick parents across the country and have to go and be closer to them to take care of them. I have providers who really like being here, but they don't have any family here, but they liked being here. There was a reason for them to be here, and now that reason isn't tying them here. And they're like, we still want to be here, but I don't have family support, and that's in another state. And we're going to take this situation is over, and now we're going to take and go back to family. So when that happens, which I want to be infrequent, we have a line of people wanting that position. We have a line of mission-minded, driven people that want to work and function in the system that we have. It's going to take some work to get there. I don't disagree with that. Our big 2030 goal, when I talked about the rhythm session and what we have, is to be the number one FQHC in Arizona. And I don't think that is purely measured by size. That is measured by community impact. It's measured by staff satisfaction. It's measured by the health outcomes. It's measured by being able to do it regularly, that fiscal sustainability piece. I think all of those pieces are important to show that we are the number one FQHC in Arizona. Now, I know I have sister health centers that are probably going to, push back at that. But if that drives them to be that much better for their communities as well, we all win.
Yeah, and so that was what I was thinking. Is this an uncommon mindset? Do you think this is uncommon?
I don't know that it's uncommon. I do think that all of the competing priorities cloud the vision. All of the things that you could do or couldn't do or are asked to do, right? There are lots of other organizations that are we like to call them healthcare adjacent, right? They touch healthcare, but not necessarily providing primary care or specialty care, but they have elements and pieces, right? They all want something from us to help make the community healthier again. It's about staying committed to the mission and to the direction, and not getting distracted. There's something that we all talk about called scope creep. Most people don't understand what that means. It means, okay, my job is to do this. Oh, but wait, I could probably help with that. And then maybe I should help with that. Oh, what about this too? And then you're so wide and broad that you forgot what you were targeting in the first place. And you're not getting there to start. It's about having good people that have that same mindset. It's about wanting it, wanting that to be the case. It takes work.
Yeah. Can you grow that mindset? I know a lot of community health centers, especially the ones we partner with, are very rural. They have a difficult time getting staff. Can you grow that mindset in someone?
I think you can to some degree. The staffing is a problem, not just with rural. We're having that in the big city as well. There's a book called Good to Great, and they talk about finding the right people to be on your bus. It isn't necessarily that you need the smartest person with the most technical skill to be on your bus. You need the person that believes in where the bus is going and has that vision and mindset and is willing to take whatever seat on that bus works to move us forward. And if it's the driver's seat, great, they can sit in the driver's seat. If it's the seat over the wheel that has to take the bumps, and they're willing to do that because they understand that when we get through those bumps, we have somewhere we're going to be, that's what you do. So you can foster it for sure, but you've got to be looking for those people where that is part of why they do this, why they're in medicine, why they're in healthcare.
Right. I agree. I mean, I've been in that situation where I have a position I need to fill and I need someone. It's so tempting to just take whoever comes along because you just need to fill that spot. You just need someone instead of
the right someone. And community health centers have been notorious. I've been in the movement since 2001. We've been notorious for a body is a body. I think we've really changed as a movement over the last 10 to 12 years on that no, we've had some people that could have filled a spot and we're like, they don't fit. Culture fit, mission fit is important, for what we do and how we do it. So I don't think that the mindset of being the best is unusual. I think everybody's trying to figure out what does that mean. I would say make it mean what it means for you.
Yes. And how do we get there with the resources that we have?
Or how do we find the partnerships to bring in those more resources?
Mm-hmm. And that's where a more visionary approach, I think, comes in. That's what I always really valued about Pima Medical Institute was the CEO was very forward thinking, in the partnerships that they made with medical complexes, because a majority of our students were medical assistants or phlebotomists, and partnering with those complexes where we had a campus, there that then agreed to take our students in their clinical experiences
Right.
and hopefully employ them. But I think that forward thinking is such an integral part, and the partnerships for sure. Do you see fee-for-service ever going away completely?
The fee-for-service world, that concept still has a place. There is some elements of what we do that are somewhat transactional, right? Not so much in the primary care realm, but the technical, the surgical specialties, the areas where you need something done, I'm doing something that's medical. I'm setting a bone. I'm taking out your appendix, right? That's a very narrowed piece. Now, some value to that is what's your infection rate after surgery, right? And having some elements that you can improve just the technical transactional piece to make that a part of a value-based arrangement. The hardest part with making that transition, in my mind, from fee-for-service to value-based care is everybody has to be willing to do it and want to do it. And it's scary to be the first. The health plans may want to do it because they're like, okay, we don't have to pay them because we're going to do it this way. Okay, you're not paying me, so I don't know if I'm going to be able to do this to get where we're at. Give us some money up front. Oh, we don't want to give you a lot of money up front and then not have it worth, right? Somebody has to be willing to take the leap. Critical mass has to be willing to take the leap. If you've got a couple health centers across the city of Phoenix and surrounding areas that are willing to do it, but the hospitals don't and nobody else does, and taking those risk contracts, it's not going to be successful. It has to be a bigger, wider industry push. I don't think that anybody's figured out what it should look like to make that big push yet. Can it happen? I believe it can. The right stuff's got to come to fruition. I think some changes from the COVID experience and the pandemic of telehealth visits has been a positive, right? The push against telehealth for years had been there's going to be fraud, there's going to be abuse, there's going to be wasted, time and how we know what people are doing and stuff like that. And when we had to do it, it was fine. Yeah. The big issues they were worried about. Now, is there fraud and waste and abuse in everywhere, in everything? Of course there is. But if you mitigate that and keep it to a minimum, then you can move things forward, because you have to be able to be willing to push the envelope on things to say, we want to make this happen. It's talking to health plans. It's talking to other partners, right? Hey, will you help us do this, right? We're looking at some foundations and some pieces to be able to do diabetic retinal screens in our offices. It's about $250,000 to get started, and then there's an ongoing $100,000 a year fee, which is expensive. But if we can get somebody to help us with that upfront piece, to get the equipment and to get the tools and to get things going, we can manage the rest, right? But how do we get it started, that capital piece to it? I'm not necessarily talking venture capitalists either, because they want a return. I recognize I'm not dumb to the ways of the world in that regards, right? They want a return on what they're doing, but you have foundations and other groups that want to give back. And how do those foundations work with us for that? Shameless plug here, we do have an annual golf tournament that's a fundraiser. This year is our 13th annual golf tournament, the Yellow Brick Open. It's got a Wizard of Oz theme going with that. That is in November. November 13th. It's down at Wild Horse Pass Golf Club down in Chandler on the reservation. We also are starting a luncheon. First year we're doing the luncheon, September 25th of this year, and I am blanking on the location. But that luncheon is a fundraiser for those who want to give back but maybe don't have a lot to give. Right, a golf tournament, that's a hefty piece, right? I'm not going to argue that. It's a big chunk for people to do. A lot of our partners, corporate sponsors, corporate partners, people that we work with, programs that we work with, Rhythm is willing to give back for that. LabCorp, they always sponsor our golf shirts that go with the tournament, right, for people that golf. But the luncheon is on a more grassroots scale, I would say. We've been talking about it for a few years, and our first one is this year. And we are excited about that. We're excited to see what happens. We are doing some awards at that luncheon. I don't know who or what yet. I know there's an advocacy award, and I know we're going to be doing some others, but giving some awards to our partners and our community members that help us. The goal was to not have a dry eye in the room at some point during the presentation, so I'm sure we'll have some of those patient stories and those mission moments to share with the group. But we're looking to make that a regular piece of what we do. www.adelantehealthcare.org. There should be links to the golf tournament. There should be links to the luncheon that we're putting together. I would imagine if they're not on the front page, because we are a healthcare organization, so we got our health stuff on the front page, that there should be a menu or a drop down of where to give back, how to donate, what you can do, how to sponsor, that kind of stuff. No, it's exciting, and it's always a good time. We have, again, our marketing team is wonderful, and they have fun with it. We, for years, we had them have an air gun cannon on one of the holes. So the guy that ran the gun would load it and everything, and he'd put it in and he'd help you steer it, and you got to push the button to shoot the golf ball from the green to the tee. And that counted as one shot. The rumor that I heard, and I haven't confirmed this yet, was that we were going to have a drone hole where you could fly the drone over the green and drop the ball to try and get it in the hole. Fun stuff like that. I mean, it is golf, and there's some pieces to it, but it gets competitive. People want to win. So it's a lot of fun. It's a nice day. There's always a luncheon. There's always a gathering to eat after. Thank our sponsors, and there's silent raffle and all those kind of pieces to the golf tournament. The luncheon is new. I'm excited to see what our team does with that and how we can learn from the first one to make the next one better and go from there.
Absolutely. I love that.
I've got a question for you.
Sure.
What inspires you the most about what you do?
We ask people this. In fact, we ask all of our new employee orientation groups every 2 to 3 weeks when they start, why Adelante? Why are you here? What do you do? Why did you make this decision? And the answers vary. We get the occasional, I really need a job. Okay, good with that. That can be as valid a reason as any other. We almost always have in every class that starts somebody who either is a current patient of Adelante, was a patient in the past, or has family members at Adelante. I mean, and it varies from class to class. We had one class where 12 people started and 11 people we either were or had family members that were patients. Right? So we see that and we ask that question. For me, it's about the people. It's about working with like-minded individuals that want to make things better. It's about what we can do to improve that health of our community. I'm in that community, right? I have kids, and they are being raised in this community. I want them to have opportunities. One of our other C-suite members, he's a fourth-generation Arizonan, and his kids are fifth. And he's like, this is my community, right? He says, this is why I get up in the morning. I need my coffee, but this is why I get up in the morning to come to work, is to do this work. I know that because it's always the answer when we talk in our NEO, because we ask all of the new incoming employees and then we give them ours. That's what inspires me, is the work we do, hitting the mission moments, finding those things where you can make a difference. Because you can make a difference on a large scale at times, but you forget the little wins. And how do you keep those little wins in focus?
Speaking to that, what advice would you give our other federally qualified health centers that tune into our podcast? If you could give them one thought, what would that thought be?
I would say keep up to date on what's happening nationally, keep up to date with what's happening across the states through the National Association of Community Health Centers. Be a participant, be active, understand what the mission is. Don't lose sight of the mission. When you're having all these things that are collapsing around you and having all these struggles, focus back on, okay, why are we here? That would be the biggest piece that I would say is if you do that, you're going to do well. The last bit I would say is reach out. Every health center is unique. They say if you've seen one health center, you've seen one health center. Well, there's 1,400 community health center organizations across the country, and I just saw this data. There's over 17,000 sites that provide care, whether it's behavioral health, dental, or primary or specialty care, all across this country. It's my understanding that there are 3 counties in our country that do not have a physical health center in them. And when you talk about some of the Midwest states, that every city is its own county and they've got 100 counties in Missouri, I've seen the map. When you, they're all just lines when you look back out. If you get in, you go, oh, okay, I can see some delineation. Every one of those counties has a health center. And there's people out there with the experience, and they've done those things, and they've had those trials and tribulations, and they exactly the problem you're having today, another health center has had in the past. And how do we as a movement work together? I don't ever look at our other community health centers as competitors, mainly because we're spread enough, right? We're not across the street from each other, but there is so much need for primary preventive health care and chronic disease management in this country that how are we competing? We can't be competing. Because we can see all the people we can see, and they can see all the people they can see, and there's still a group of people that don't have anywhere to go because we're full. Right? And we need more providers, and we need more staff to be able to help those patients that don't have anywhere to go. Choice is a positive. It keeps you on your toes. Keeps you being the best you can be.
And ultimately, we're all in this together, kind of like you said earlier.
Yeah. Correct. We are all a part of the bigger, broader healthcare community. And how do we do it right?
Absolutely. When I was working at Pima Medical Institute, I ran the Surg Tech program there, but we also had an ultrasound program, and their students were needing to learn how to put gloves on sterilely. And so I was like, well, just have them come over to my lab. Like, I'm more than happy to help them. And they're like, well, these students aren't in your program. We're all here for the same reason, which is to help our students, and help them help patients eventually. So then we started collaborating more across programs, and which was really beneficial for the students. So the collaboration is so important. Any other thoughts, questions?
No, I want to thank you guys for the opportunity. It's exciting to get a chance to talk about what we do, to get more people to hear about what we do. I had conversation the other day, and somebody in the group lives out in Mesa, and they were new to us, or they were a board member that lived out in Mesa, and nobody knew who Adelante was. Wow. Now, we have one clinic in Mesa, and it's on West Mesa, and they lived in East Mesa, but we used to say we were the best kept secret in town. We didn't like that. We didn't want to be the best kept secret in town. We think that's changing, but it can always continue to change. So having this opportunity to talk about us, to talk about what we do, and to encourage people to come visit us is welcome, and I thank you for that.
If anybody wants to connect with you, how can they do that?
If anybody wants to connect with me specifically, email is probably the best option, and that's Babyar, B as in boy, A, B as in boy, Y-A-R, at adelantehealthcare.org. There'll probably be an option on the website to find that for y'all. If you're interested in Adelante in general for jobs or opportunities or need a doctor, our website, as I gave previously, www.adelantehealthcare.org, and you can surf through that website to find whatever you need.
Thank you. The conversation was very insightful. I enjoyed it very much.
Awesome. Thank you.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.